This nice patient has been with me for a couple of years at least, and he's got a complicated medical history. He's got a low-grade lymphoma, and he's done marvelous with that. He's got a little neuropathy in his feet because of the vincristin, but he was really in bad shape a year ago with severe pain for several months in his entire back. And we looked at that and decided he had bad fibromyalgia. He is a real trooper, and I think it was maybe 300 shot treatment. I don't know, maybe 2, but it was a brief period of time where we did them both, and his pain completely went away for 3 months. And then he got this little bit of stiffness, which still doesn't aggravate him very much, so he's been living with it all that time, but it's never ever escalated anything close to what he had before. Today he decided, well, why am I dealing with this? Why don't I look into it? And so we marked him, and it's interesting. When we did him before, he looked like, that he had the measles. There were so many marks. Now what we have, we see a couple of lines that go all the way up here, and on the other side all the way up here. Interesting, on exam, we did it standing up and found a certain amount, and then we found 50% more stuff when we had him lie down. So it shows you that sometimes it's better to pick your pain spots in a couple of positions. Now over here, the side of his leg, same thing. We had done that. You see it goes all the way down his leg, and and we had treated that before too, and he's done well. Clearly at this point, I think it's a more low-grade fibromyalgia. I'm optimistic in 1 or 2 treatments we can get him better. If for some reason he needs a sacral caudal, we can do it, but I doubt it. I think this is just a tough fibromyalgia, and he'll be emailing us in a couple days, in a week, and we'll determine if he needs another treatment. Interestingly, when we got done with that, he kind of noticed he had a little hamstring issue, and sure enough, we found a couple of active lines in the hamstring, not any on the right, and now we've got the whole situation documented.